Hey everyone, welcome back to the channel. Today we're diving into a super important topic that could potentially save your life. We're talking about the 10 warning signs of liver damage you shouldn't ignore. Your liver is a powerhouse organ, responsible for filtering toxins, digesting food, and producing essential proteins. When it's not working properly, your overall health can take a major hit. That's why it's so important to be aware of the warning signs and symptoms your body might be sending you. So let's get started. Our first warning sign is jaundice, which is characterized by the yellowing of the skin. This yellowing can be quite alarming and is often one of the most noticeable symptoms that something might be wrong internally, and the whites of the eyes. Now you might be thinking, okay, how does this relate to my liver? Well, the liver is responsible for processing bilirubin, a yellow pigment that's produced during the breakdown of red blood cells. When the liver is functioning properly, it efficiently removes bilirubin from the body. However, when the liver is damaged or diseased, it can't process bilirubin efficiently, causing it to build up in the bloodstream. This inefficiency can be due to various liver conditions, including hepatitis, cirrhosis, or liver cancer. This buildup is what leads to the yellow discoloration we see in jaundice. The more bilirubin accumulates, the more pronounced the yellowing becomes, affecting not just the skin and eyes but sometimes even other parts of the body. Jaundice is often one of the first noticeable signs of liver problems, and it's definitely not something to ignore. It serves as a crucial indicator that your liver might be in distress and needs medical evaluation. If you or someone you know is experiencing yellowing of the skin or eyes, it's crucial to seek medical attention immediately. Early diagnosis can make a significant difference in treatment outcomes. Remember, early detection is key when it comes to treating liver disease. The sooner a problem is identified, the better the chances of managing it effectively and preventing further complications. Don't wait for the symptoms to worsen before taking action. Procrastination can lead to more severe health issues that are harder to treat. Your health is precious, so take it seriously. Make regular checkups a part of your routine and listen to your body's signals. Let's talk about another important warning sign: abdominal pain and swelling, specifically in the upper right abdomen. This area is crucial because it houses several vital organs, including the liver. This is where your liver is located, so discomfort or pain in this area can be a red flag. The liver plays a vital role in detoxifying your body and producing essential proteins. You might experience a dull, aching pain, or it could be sharp and stabbing. The nature of the pain can vary greatly from person to person. Sometimes the pain can radiate to your back or shoulder blade. This referred pain can make it difficult to pinpoint the exact source of discomfort. Along with the pain, you might also notice some swelling in your abdomen. This swelling can be subtle at first but may become more pronounced over time. This can happen due to fluid retention, also known as ascites, which is a common complication of liver disease. Ascites can cause significant discomfort and impact your daily activities. As the liver becomes damaged, it can lead to a buildup of fluid in the abdominal cavity, causing swelling and discomfort. This fluid buildup can also put pressure on other organs, exacerbating the pain. If you're experiencing persistent or worsening abdominal pain, especially in the upper right quadrant, it's essential to get it checked out by a doctor. Early diagnosis can make a significant difference in treatment outcomes. They can determine the underlying cause and recommend the appropriate treatment plan. This might include lifestyle changes, medications, or further diagnostic tests to manage the condition effectively. Now, let's talk about a symptom that can be a bit tricky: chronic fatigue. It's something that many people experience but often overlook. We all feel tired from time to time, right? It's normal to feel worn out after a long day or a sleepless night. But when it comes to liver damage, fatigue can be relentless and overwhelming. It's not just about feeling sleepy, it's a deep, bone-weary exhaustion. You might find yourself feeling exhausted even after a good night's sleep, waking up feeling like you haven't rested at all. And simple tasks that you used to breeze through might feel incredibly draining. Even carrying groceries or doing household chores can feel like climbing a mountain. This constant fatigue is often one of the earliest and most common symptoms of liver disease. It's your body's way of signaling that something isn't right. When the liver is damaged, it can struggle to perform its many functions, including converting food into energy. This inefficiency can leave you feeling perpetually tired. This can lead to a significant decrease in energy levels, leaving you feeling constantly fatigued. Even eating a meal might not give you the energy boost you expect. If you're experiencing persistent fatigue that's affecting your daily life, making it hard to work, socialize, or even enjoy your hobbies, Don't just brush it off as being too busy or stressed out. Chronic fatigue is a serious issue that deserves attention. It's important to talk to your doctor to rule out any underlying medical conditions, including liver problems. Early diagnosis can make a significant difference in managing your health. Next up, we have nausea or vomiting, which are never pleasant experiences. While these symptoms can be caused by a variety of factors, they can also be warning signs of liver damage. The liver plays a crucial role in digestion, producing bile that helps break down fats. When the liver is struggling, it can disrupt the digestive process, leading to feelings of nausea and even vomiting. You might experience these symptoms after eating, especially fatty or greasy foods, or they might occur without any obvious trigger. If you're experiencing frequent or unexplained nausea or vomiting, it's essential to consult with a healthcare professional. They can help determine the underlying cause and recommend the best course of treatment. Remember, addressing these symptoms early on is crucial for preventing further complications. Let's talk about another digestive symptom that can be linked to liver health: loss of appetite. Now, it's normal to have days where you're not as hungry, but if you're experiencing a sudden and persistent lack of interest in food, it could be a sign of a deeper issue. When the liver is damaged, it can affect your body's ability to digest food and absorb nutrients properly. This can lead to feelings of fullness, even after eating very little, and a general decrease in appetite. In some cases, people with liver damage might even experience unintentional weight loss due to their reduced food intake. If you're noticing a significant change in your appetite or eating habits, it's important to bring it up with your doctor. They can assess your overall health, order any necessary tests, and help determine the underlying cause of your loss of appetite. Now let's move on to a symptom that you might not think twice about: dark urine. While the color of your urine can vary depending on your hydration levels and certain foods you eat, consistently dark urine can be a sign of liver dysfunction. Remember bilirubin, the yellow pigment we talked about earlier? Well, when the liver is damaged, it can't process bilirubin efficiently, and some of it ends up being excreted in your urine. This can give your urine a dark yellow, brown, or even tea-colored appearance. If you're noticing a persistent change in the color of your urine, especially if it's accompanied by other symptoms like jaundice or abdominal pain, it's important to seek medical attention promptly. Early detection and treatment of liver problems can make a significant difference in your long-term health outcomes. Just like dark urine, the color of your stool can also provide valuable insights into your liver health. While it might seem a bit awkward to talk about, trust me, it's important. Normally, your stool gets its brown color from bilirubin, that same pigment we've been discussing. However, when the liver is damaged and bilirubin isn't being processed properly, your stool can become pale or clay-colored. This is because the bilirubin that would normally give your stool its brown color is instead building up in your bloodstream and being excreted in your urine. If you notice that your stool is consistently pale or clay-colored, it's essential to consult with a healthcare professional. They can evaluate your symptoms, order any necessary tests, and determine the underlying cause of this change in your bowel movements. Now let's talk about another symptom that can be a bit more visible: swelling in the legs and ankles. This swelling, also known as edema, can occur for a variety of reasons, but it can also be a sign of liver problems. When the liver is damaged, it can disrupt the body's fluid balance, leading to fluid retention, especially in the lower extremities. This happens because the liver plays a crucial role in producing albumin, a protein that helps keep fluid in the bloodstream. When albumin levels are low, fluid can leak out of the blood vessels and into the surrounding tissues, causing swelling in the legs, ankles, and feet. If you're experiencing persistent swelling in your lower extremities, it's important to consult with a healthcare professional. They can determine the underlying cause of the swelling and recommend the appropriate treatment plan. Let's talk about a symptom that can be incredibly frustrating and uncomfortable: itchy skin. We all experience an itch now and then, but when it comes to liver damage, itchy skin can be relentless and widespread. This persistent itching, also known as pruritus, is thought to be caused by a buildup of bile salts in the bloodstream. When the liver is damaged, it can't process bile salts efficiently, causing them to accumulate and irritate the skin. You might experience itching all over your body, or it might be concentrated in specific areas. If you're experiencing persistent itching that's interfering with your sleep or daily life, it's important to talk to your doctor. They can help determine the underlying cause of your itching and recommend the best course of treatment. Finally, let's discuss a symptom that can be a bit alarming: easy bruising or bleeding. While occasional bruises are normal, especially if you've bumped into something, frequent or unexplained bruising can be a sign of an underlying health issue. including liver problems. The liver plays a vital role in blood clotting, producing proteins that are essential for stopping bleeding. When the liver is damaged, it can't produce these clotting factors effectively, making you more susceptible to bruising and bleeding. You might notice that you bruise easily, even from minor bumps or scrapes, or you might experience prolonged bleeding from cuts or nosebleeds. If you're concerned about easy bruising or bleeding, it's crucial to consult with a healthcare professional. They can assess your symptoms, order any necessary tests, and determine the underlying cause of your bleeding issues. Thanks for watching. If you found this video helpful, make sure to give it a thumbs up and subscribe for more health tips. And remember, if you're experiencing any of these symptoms, it's important to consult with a healthcare professional. Your liver is an amazing organ, but it's not invincible. By being aware of the warning signs and taking care of your overall health, you can help keep your liver functioning properly for years to come. Take care and stay healthy.